original training was at the University of Kentucky in ENT, or ear, nose, and throat, head and neck surgery. Then I did a 2-year plastic surgery fellowship at Vanderbilt University in Nashville. I followed that with a 1-year specialty fellowship with Operation Smile, where I traveled throughout the world doing mission trips, operating on babies with cleft lip and palates. I also spent 3 months of that 1 year in Paris, France, working with a Dr. Eric Arnault, who is a cosmetic surgeon. What was interesting was most of what I did at that time was focused on faces, whether it was a baby's face or an adult's face or an aging face. So when I came back here in 2000 to join Dr. McGee, I was very focused on children's work. And as the years went on, I had some different life-changing events in my own life and changed the scope of my practice. In 2005, I became more cosmetic surgeon. And then in 2012, I became about 80% cosmetic, with 20% still being reconstructive. I still see a lot of patients with skin cancers and reconstructive issues that I very much enjoy to work on them as well. In 2017, I left my original practice. So in 2021, I became very focused on deep plane facelift. I spent 2 years studying, reading, going to courses, visiting certain doctors. I visited Mike Nyack in St. Louis, Missouri, who's a world-famous deep plane facelift doctor. And I visited Dr. Jason Diamond in Beverly Hills, and I spent 2 years working alongside of him, learning some of his techniques, and then incorporating them into my own practice. Of course, with the deep plane facelift, there's several operations that go with it, like a brow lift, upper eyelid surgery, lower eyelid surgery, lip lifts, skin rejuvenation, fat grafting, buccal fat removal. There's a lot of other adjunctive procedures that go along with the deep plane. So I really wanted to become an expert in just one area, one part of the body. So in the last part of my career, I could just concentrate on one thing and be really, really great at it.